So I'm here in New York City for a cosmetic surgery meeting. And one of the things that we're really going to be focusing on this time of year is trying to come up with new filler materials and new things that we can do to make you look as youthful and as perfect for the holiday season as possible. And you can see around me, this gorgeous hotel also is doing that same kind of a thing. So stay tuned because we have a lot of interesting things that we're going to be talking about at this special meeting. Hi everybody, I'm here with Dr. Joel Cohen, very, very famous, board certified, fellowship trained dermatologist, but I'm in Manhattan and we got to talk a little bit real quickly because he's going up on stage in a minute. Plastic Surgery Revolution. Couple quick questions. I know you did your training with the Carruthers, who are like the people that started this whole Botox thing. Give me a couple of quick things that you could tell me that helped you with, or that you learned from them, or anything like that.
So Alistair and Jean Carruthers are really the pioneers of using botulinum toxins, and they described the first cosmetic use of Botox really back in the late 1980s. So Jean is an oculoplastic surgeon and Alistair is a dermatologist. And she actually noticed that when she injected patients for blepharospasm or strabismus or different things in the periocular area, that they actually had softening of the muscle here and here. And that led to what we do commonly today all the time.
So you're so involved in not only just doing clinical studies and things like that, and doing like also practice. How do you blend all these things together? Because that's something I always talk to you about, because I think you did do a lot of fellowship training in lasers and in Mohs surgery. So how do you do all that and still have time to do the papers and the research and things like that?
Well, first of all, I was a history major and I love really putting the story together. So I'm an avid reader, and I've always liked to write. And when it comes time for family occasions and things like that, where you give a speech, that's one of those things. My kids had bar mitzvah, bat mitzvah, and you write a great speech. And I think when you are able to tell a story, even in the introductory paragraphs of something like, hey, this was discovered by, we're going to talk about this, and we're going to review this, or this is a novel concept, and this is where it came from, those types of things. So I think every article is a story, and it really allows us to express ourselves, design a study, and then I'm super type A, so I'm type A positive, which is my blood type, and I actually, when I dictate to my transcriptionist, I actually put the commas and the periods and the exclamation points and the capitals and the paragraphs. And I like to do that. It gives me a sense of completion when I'm writing a chapter or writing a paper.
Yeah, I love that. Last question. What do you see moving forward to 2022? Because you're at the forefront of all these things happening. You got your finger on the pulse of everything in aesthetic surgeries and everything.
I think as we move forward into 2022, I think I learned from my colleagues and my friends and my mentors. I'm with Dr. Steve Davis, a world famous plastic surgeon right now, and our videographer is Dr. Tom van Eijk, and from the Netherlands, who's discovered ferning and written about that. And we're just hanging out at a meeting. We all come from different backgrounds, different places, and we're all friends because of opportunities like this. And this allows us to learn together, to learn from each other, and to see what other people are doing. And I think for me, that's incredibly exciting. And I will say that I had a light bulb that went off recently for me in terms of some of the things that we do, because, honestly, I do sit-ups every once in a while. And then, I know about M-Sculpt and all this. With M-Sculpt Neo, I was intrigued because David Kent just did an article about reducing visceral fat. And honestly, I'm optimistic that we're at this transition point between, we know that some of the aesthetics that we do make people feel better about themselves. And when you feel better about themselves, you may have more self-confidence, you may project yourself differently. We know that working out similarly does these types of things. And I think we're seeing the ability for some of the aesthetic things that we might do to actually transcend to the medical world. And that was one of those things that the light bulb went out for me.
That's fantastic. Thank you. Everybody, you've been listening to the Plastic Surgery Revolution, and we'll be back talking to you next week. Thank you. at you. I've begun you. Welcome everyone to the Plastic Surgery Revolution. I'm your host, Dr. Stephen Davis, and I actually have someone here who is an aesthetic physician from the Netherlands, from Amsterdam. It's Thomas van Eijk. And here he is. He is very, very well known for a technique that he came up with back in 2004 or 5. Four.
Yeah,
It's
long time.
It's a long time ago, but he still looks unbelievable. Does look a lot like David Spade. Do people tell you they know who David Spade is? He's a comedian, but you look a lot like him. You have really good hair. I wanted to ask you, if you want to explain to people what the Fern technique is and how you came up with it, and it's like a lot of people that may be like, you know, lay people, really not in the medical community, what would you say that is?
Well, the essence is that if you inject hyaluronic acid, which is like the most common filler,
Right,
you can do it in several layers of the skin or under the skin.
right,
Most people tend to inject under the skin to fill out the face,
correct.
which is fine if you need volume. But sometimes you find that a wrinkle or a fold doesn't require volume to be corrected, but requires strength.
Strength of the skin.
Yes. And if you inject that same hyaluronic acid not under the skin, but in the skin, where the leather is, where the collagen
Yes.
is, then you strengthen without giving volume. So you can actually choose when you have the filler in your syringe whether you want to give volume or strength.
I understand.
And if you find a fold like this one not being there because there's a lack of volume underneath, but because there's a lack of strength of the skin, because of the disruption of the collagen,
Right.
like damage, then adding strength makes more sense than adding volume.
Absolutely understood. So when you're coming up with the idea of a Fern technique, you're saying if you're coming at it together, you're building strength where
Yes.
that wrinkle would merge.
If the wrinkle is in the middle, and
Right.
if you inject from one side and you inject from the other side, and you intertwine those injections,
Right.
you can see that's very strong in the middle. So this is where the damage is at its peak.
Gotcha.
It's where your correction is at.
Now-
That the alternating effect that resembles the leaves of the
The
fern.
leaves of the fern.
That's it.
I like that. Have you found that the hyaluronic acid is like a semi-permanent type of a filler because it is actually stimulating the patient's collagen production at the same time?
Right. Whenever you put hyaluronic acid in the dermis will respond by producing more collagen,
Exactly.
which is a stiffening
Yeah.
element.
Right.
So you can imagine that if you add strength on the skin in a pattern reacting to the weakness you have found, then the skin will respond by producing more collagen in that same pattern.
Absolutely.
You kind of rebuilding actual natural collagen.
Now, in the Netherlands, I'm sure you have a lot of other kinds of fillers than we have in the United States that are not maybe FDA approved and things. But have you found things like Sculptra or other things that you use in conjunction, or you're strictly hyaluronic acid?
I use Sculptra because, well, Sculptra needs to be injected deeper
Yes.
than hyaluronic acid. And it gives an overall global thickening and strengthening and improvement of the skin,
Right.
which is good. But sometimes you have very distinct damages, lines, or scars, acne scars,
Yeah.
for instance. Then you don't need a global, cloudy
Gotcha.
strengthening. You need a very distinct correction of what nature has done, damaging collagen.
And I think your presentation that you just gave was phenomenal because you did go through the stages of when you start to develop these secondary and older type of things that happen to your skin as you age. It's like a whole, as you were calling it, like a chaos that's happening
Yeah.
for everything.
Yeah.
And I thought that was really, really smart because it is, you called it not just chaos, but you
Entropy.
called it entropy. That's
Just to
true.
make it posh.
I love it. I love it. Everyone, you've been listening to a very, very famous guy named Dr. Thomas Eijk, and you're listening to the Plastic Surgery Revolution. I'll be speaking with you again next week. Bye-bye for now.